I love it. PCOS is my favorite condition. Let me explain to you. Many physicians that haven't done research in this area on the ovary and how the ovary works are confused by PCOS. This is really simple. It's not complicated. Women with PCOS have been born with an excessive number of eggs. It's not a so-called complex metabolic syndrome. There are 1,500 research articles every year that are all so mixed up on PCOS. It's just these women have an excessive number of eggs. That inhibits the pituitary gland in the first part of the cycle. So you don't have enough FSH to recruit a dominant follicle, and you have irregular cycles and you don't ovulate. And if you're given stimulation to try to make you ovulate, you could superovulate a huge number of eggs and have a dangerous multiple pregnancy. We don't want that. So the approach for PCOS is simple. Your age is 30, which is great. So your eggs will be relatively young, and we'll first suppress you with birth control pills. So we get rid of all the old, bad quality, terrible eggs, suppressing you for 30 to 40 days. And then we'll stimulate you for a Mini-IVF protocol so that we don't cause a dangerous hyperstimulation syndrome, because we don't want you to get sick from overstimulating with gigantic numbers of follicles. And then we'll transfer either one or two embryos, depending on your choice, but we'll freeze anything extra over that. So you don't run that risk that you would run if you did IUI and hyperstimulation with hormones. IVF is really a much safer approach, and it's the best approach for PCOS. Now, one other point, I know the time is up, but for women's health reasons, you should not be allowed to have these irregular cycles with PCOS for your whole life, because those are estrogen-dominant cycles, which will lead to a higher risk of uterine cancer much later in life. And so women with PCOS should be on birth control pills when they're not trying to get pregnant, 21 days on, 7 days off, and should be doing IVF when they do want to get pregnant. So it's a simple solution, really.